Thank you, Angie. I'd be remiss if I just didn't very briefly mention thank you to both Sage and CASA for being here today. You guys do the street level work every day, getting out in those communities. So I just want to thank you both. Very strong leadership, strong boards, strong work that you're doing out in the community, and you're making a difference. So we appreciate you. So going back to ARPA, and I apologize for missing you, Angie, but I appreciate you're here. We're here to develop a plan for the allocation of $26 million in federal ARPA funds dedicated to mental health. I want to be sure that we're clear about what that means. The funds are to be used for rescue and recovery from the effects of the pandemic on the community's mental health. I believe that mental health in our community has been for a long time an urgent need. For the pandemic, now it's an emergent need. I think it's an emergency on a lot of levels. So I think the purpose of our work here today is very important, and it's to provide direction to city staff to develop the rescue plan. There is, though, a general direction to follow. Second, the plan will outline programs and strategies that will address those impacts. To put it another way, what will rescue look like? Third, we'll define the outcomes and lay out how these outcomes will be measured. I think measurement data is important in this plan. And fourth, we'll establish a timeline for the rescue. There's no doubt that the pandemic's effect on mental health is a public safety concern. Public safety is more than just police and fire. It's what the general public needs to feel safe. As stewards of public safety, we cannot just react to the crisis at the time. We need to look at what can be done before emergency services are needed, as our police and fire are taxed to the max. They're out there every day also doing important work, and sometimes the needs are overwhelming. The emergency service, they're needed, and the care and treatment needed after the emergency call is placed. So specifically, I'm talking about, yes, we need to look at the crisis the day of, but I like to focus on pre-crisis and then, of course, post-crisis. Our guiding principle, our goal, is to plan a rescue and make the best use of funds available to do it. It has to be done in a way that allows for long-term sustainability. That leads to new or existing mental health strategies and programs. We need to have community involvement, which we see here today in our conversation, and we need to use this opportunity to lift our conversation above the stigma that is associated with mental health disorders. So with that, we'll move on to item 2. I just want to, just make the point that this is a very important conversation that we're starting here in this room today. And I trust and believe that at the end of this process, that it's going to make a difference to the people that we represent, council members, but all of our community. So go ahead, Maria.